Today I'm here with Nicholas Westers, clinical psychologist at Children's Health and associate professor at UT Southwestern Medical Center. So can we talk about what's the difference between sadness? Like kids are sad and maybe we don't have to do anything to fix that, but then how do we know if it's depression?
Uh, yeah, none of us like to see our loved ones suffer or experience distress like sadness or depression. And so it's hard to allow ourselves to give them the space to struggle and make sense of their own feelings and process them or metabolize them in a healthy way. And so the way I differentiate between sadness and depression as a clinical psychologist is sadness is typically temporary in nature, triggered. There's usually an identifiable trigger, and it's a normal human emotion that all of us feel. And it doesn't cause significant distress in our day-to-day functioning. Depression, on the other hand, not all of us experience, at least major depressive disorder, and that's where it causes significant impairment in our day-to-day lives. It's not always identified or by a specific trigger. Sometimes it can come out of a genetic tendency that may run through the family, coupled with a significant stressor like the pandemic or something similar to that, where it starts maybe the depression. But there's not always an identifiable trigger. And so those are the two main differences, as well as with depression, there are other symptoms that co-occur all at the same time consistently over at least 2 weeks of time. So there's difficulties with sleeping, difficulties with appetite, sustaining attention, irritability. There's sometimes suicidal thoughts. There's lower energy levels. There's a whole different, like a whole number of symptoms that we look at in psychology. And when they co-occur and last from consistently over weeks at a time and impact functioning negatively, then that's a significant concern that we would call a mental health disorder.
So if let's just say like your teenage kid just gets dumped by the love of their life, right? And they don't get out of bed for quite a while and they're just deeply sad. So is that is there a point in time where that parent should consider that there needs to be some kind of intervention? Like how do you know when an episode causes deep sadness that looks and resembles depression?
That's a great question because we do see that most of us have had breakups and at some point in life, and it's one of those things that are really disappointing usually and really difficult usually, and result often in sadness where maybe your teenage child stays in bed all weekend and just doesn't eat anything, and you may be concerned about that. But I think where individuals and parents actually become more worried is if their teenage child does already have a history of depression and maybe they've recovered or overcome and no longer have depression, but then this may trigger depression, or at least that would be the worry. And so sometimes I'll even hear people say, like after a breakup, like you had mentioned, my depression is back. Fortunately, that's not how depression works. So that would be an appropriate response to disappointing news. So staying in bed, not eating. So some of the depressive symptoms are there, but they're not there to the significant degree over time, persistent, that we would typically see in, say, major depression, like a major depressive disorder or major depressive episode. And so I think what parents are going to want to be in tune with is knowing, one, your teenager, do they usually bounce back from situations or disappointments like this? And if they do, how long does it take usually? Is it a weekend or is it a couple of weeks? On the other hand, if your teenage child is now a month later still struggling to eat, still struggling to take care of himself or herself, still struggling to sleep well, or maybe they're sleeping too much, not at all, that's going to be more of an indicator of depression as opposed to appropriate sadness.
So if I have a kid who at some point went to see a psychologist and a psychiatrist and was put on medication or talk therapy for depression, and now they seem to not be confronting that right now, are they more susceptible to having a second one?
Not necessarily. I think where we get more concerned is if there is an episode of major depression that lasts at least a couple of weeks and on, that's a significant impairment in functioning. And then there's a couple months where that just goes away and there's just no symptoms to a significant degree at all during a couple months. We call that remission, or in recover, like a recovered episode, and depression is gone. But if that happens 3 or more times, where there's this at least 2 weeks or more of depression, and then 2 months or more of no depression, and then that cycle, then we actually have a different term for that. Well, it's major depressive disorder, but recurrent. So as opposed to a single episode, and those who have multiple recurrent episodes are likely to continue experiencing multiple episodes of depression if they don't consistently take medication. So individuals who have just a one major depressive episode may only need medication and therapy that helps them get over the hump, and then they stop therapy and they stop medication and they're fine. Those who continually experience that 3 episodes or the cycle of depression and remission are actually more likely to need at least ongoing medication management for the foreseeable future, but more likely also to need to return to therapy each time that they may experience depression, if at all, if they're taking medication consistently.
Someone just told me this story that their kid said to them, I just want to wake up in the morning not feeling sad. So we use sad a lot, right, as language, and we don't necessarily know, like, if you heard that, would you encourage that parent to seek help? Or would you say, like, watch out for this, this, and this?
I might not jump to suggesting seeking professional help at that moment. I might be more inclined to wonder like how they're sleeping in general. Are they exhausted in the morning and feeling sad because they're not sleeping well? Not necessarily because of depression, but because of something else that might be going on in their lives, or maybe they have a sleep disorder that needs to be addressed in some medical way. But if they're complaining of feeling sad every single morning and they're not getting out of bed at all, or it takes hours for them to get out of bed if they do, or if they're not socializing, or if they're not eating, and I'm looking at all these other symptoms of depression, if those are co-occurring in addition to the sadness, then I would be more worried. However, if your child doesn't want to feel sad every time they wake up in the morning and they want to talk to someone about that, to maybe address strategies to overcome that so they don't necessarily have to feel that way every morning, then by all means, we don't have to have a mental health disorder or have something going on or wrong with us to benefit from talking to someone and talking to a mental health professional and participating in therapy. So I think parents may want to ask their teenager that question if they'd like to talk to someone about that, but also look for these other symptoms.
Okay, you said, so if someone was to call you up and say, that's the scenario of my kid, and obviously we're not giving any kind of mental health recommendations to anybody watching this right now, but in the abstract, so you talked about sleep, but you could not be sleeping because you have issues going on, or the not sleeping could cause some issues, right? It can go both directions.
Yeah, absolutely. So another reason why people may wake up in the morning exhausted or sad is because they're on technology all night, and that could be. But you had mentioned, we do know from research that poor sleep is a risk factor for depression. It's a risk factor for suicidal thoughts and behaviors, and so sleep research is consistently coming out how important it is to get adequate sleep. And most teenagers and children are not getting enough sleep. And I will say though, when someone calls me up and wants to schedule for therapy, one of my initial questions is, does your teenager want to participate in therapy? Because that'll give me a good indicator of how ready they are and how much if are they going to engage in therapy? Are they going to respond well? Or is it a waste of their time and it's not going to benefit them at all? So having buy-in is one of the things that I'm going to be looking for. And so if your child, if you make them go to therapy and they're not ready, they may not have the greatest experience. And I want to make sure that they feel that they can ask for help at any point in life down the road. And so one of my jobs I see in my mind as a psychologist and when I'm doing therapy is to provide a successful and positive experience. So that way, when they do recover, if they do recover, in as far as getting rid of all the symptoms and stop coming to see me for therapy, they've had such a positive experience that years down the road, if they need to go back to therapy, they know that it's helpful. And so they don't have to be in therapy forever, but I want them to have that experience where they're okay with asking for help in the future.
So I understand why you're putting that out there, and I feel a little disappointed by that because I want to push my worry onto you because you're the expert and you're going to take my kid who shows up like this and turn him into an eager beaver for your advice. And you're saying it doesn't go that way?
Sometimes it does. Sometimes I'll get buy-in for like a few sessions from a teenager, and then they're like that. Then they don't want to come at first, and then we get talking. And that's the ideal situation, but it doesn't always work that way. And I will say that children and teenagers take their cues from us as adults in modeling. And so one of the questions I might pose to parents is, how safe is it in the home to fully express how we feel without being dismissed because of it? So what I mean by is, you wake up, you mentioned the example of a teenager waking up sad every morning. Well, what do you have to be sad about? Like, it's a great day, just, you have so many friends, nothing to worry about. We're not like, you're not like starving kids in whatever country. That's a quick dismissal of sadness, as opposed to, oh, I'm sorry you're feeling sad. Is it any reason as to why you might be feeling sad? And if not, then like, well, is there anything I can do to help or support you? And actually doing that itself, as opposed to just jumping to therapy, might be what they need, because a kind and compassionate response from you as their parent could be for them the difference between like seeking help on their own now, or even in the future when they're an adult, or suffering alone because they don't think that mom or dad can handle my sadness, because they just want to just sweep it, either like say it's not there's no reason to feel sad, or that I need to go talk to someone about that because there's something wrong. And so I think sadness is a normal emotion. It's not a comfortable one by any means. And so, like I said at the beginning, it's hard for parents to tolerate that distress in their child,
Yeah.
and not want to fix it right away.
Okay, so you mentioned some language that is a like a not so great way to start the conversation, and then a safe way for your kid to open the conversation. If we move along the continuum, which is the ultimate fear that we all live with, that we miss signs of suicidal ideation, um, what is there something to talk to our kids about?
I would say that the difficulty oftentimes with the conversation about mental health, sadness, depression, and suicidal thoughts is not on the child's end. It's often on the parent's end. Because what if I were to ask about this, one, and that maybe I'm giving them an idea that they hadn't already considered, and I don't want to put that thought in my child's head. Or two, what if they say yes? What do I do with that information? And so I don't want to have that responsibility. So it's easier for me emotionally to just assume everything's okay. And so one way parents may do that is they may say, "You never had thoughts about suicide, have you?" Well, the correct answer to that is, your teenager knows, is no, because they know that you're not comfortable with a yes in that moment because the way that the question was phrased. But what we do know from research is that it's okay to ask about suicidal thoughts. It's not going to put the idea in their heads if they have not already thought about it. And if they have thought about it, we know from research that asking about it opens the door for them to feel safe to talk about it. And it decreases their chance of acting on any suicidal thoughts should they have any. And so it's okay for parents to check in with their child and ask, because what we also know through the CDC research that comes out every 2 years is that 17.2% of high school adolescents have reported seriously considering attempting suicide within the past 12 months. And so we're almost at 1 in 5, 1 in 6 teenagers have actually thought about that. And it's a scary thought to consider that maybe your child is one of those 5, or 1 in 5, 1 in 6, and being able to talk about it could actually decrease their chances of acting on it, especially if we ask it in the right way.
So I think we talked about like the not way to say it. You're not thinking about it. What's the right way to say it?
I've heard that a lot of teenagers may struggle with thoughts of suicide. Do any of your friends, have they ever felt that way to your knowledge? Now that will open the door, if it's too hard for you to know your own child in that moment and their thoughts, that it'll get them talking about their friends. And then, well, what about you? Have you had thoughts ever about hurting yourself, like suicide? And then listening, rather than jumping in and say, you have no reason to think about that. There's no, I love you. your mom and I, your dad and I, we love you. Why would you think that? That's immediate judgment and it closes the conversation. And they know it's unsafe. And so opening it up. I'm sorry you feel that way. In what way can I support you? Is it okay if I check in with you every once in a while about these thoughts? Would you like to talk to someone? Or if they've actually had thoughts recently, then I think we need to talk to someone because I don't feel comfortable managing that by myself as your mom or as your dad. I want to support you, but I think that's beyond my knowledge of how to manage and help you in this moment. So let's schedule something, an appointment for you to be able to see a therapist.
I'm uncomfortable even hearing you model the language. Like
Okay.
it's so uncomfortable to think about having that conversation. Um, is if it gets to the point where the answer is yes, um, is my kid relieved that there's an adult who is saying we need to get someone who really understands how to manage this? Are they relieved, or do they feel like I wish I hadn't said anything?
I think that's going to depend on how you respond as a parent. They may think that if they're being judged or dismissed or have no reason to feel this way or have these thoughts, then they may close down. Because let's be honest, our teenagers and children know that it's not easy for parents, us as adults, caregivers, to hear this kind of information. And so it's not foreign to them that it's not going to be good news to you as a parent to hear this information. But again, like I had mentioned, often that discomfort's on our end as adults. And so being able to practice and over, even in role play or looking in the mirror and practicing how you might word that conversation or word the question and how you might respond in a way that's going to be helpful because yeah, that's a really tough question. If they say yes, what if we start to cry or lose it? Then our child may think like, mom and dad can't handle this information. So whereas a lot of teenagers are going to feel relieved um, because their parents are interested, invested not only in their sports and their academics, but also in their mental health and their thoughts about life and existence, and if there's any concerns about suicide, then that's great to know that they can talk to mom and dad about anything. However, if the response is negative, yeah, they probably are not going to want to talk about it. They could shut down.
Dr. Nicholas Westers, thank you so much for your time.